Hello, I'm Dr. Cheryl BryantBruce, MD. My patients call me Dr. Cheryl. I'd like for you to call me that too. I'm here to share with you today an exciting new program for Medicare patients. I've recently partnered with a company called 100 Plus, and with 100 Plus, I'm able to bring to you continuous patient monitoring. So for Medicare patients who have at least one chronic condition, and qualifying chronic conditions include things like high blood pressure, diabetes, asthma, emphysema, congestive heart failure, even obesity can be a qualifier. If you have at least one qualifying chronic condition, then you can become involved with this program, and you and I can team up as partners to help manage your wellness. You see, by working together with me, you take a series of testings, and I'm able to look at the results of that monitoring and help you to better manage your condition. Let's say, for example, let's talk about blood pressure. Here's one of the beautiful devices that the company 100 Plus provides to Medicare patients at no charge. This is a free program, completely free, for Medicare patients. So you receive your blood pressure cuff and you start monitoring your blood pressure daily. The results of that blood pressure monitoring come to me. Now, in the event that your blood pressure is abnormal, I'll get a notification, and that notification is actually weighted so that it tells me if your blood pressure is just a little bit abnormal or if it's way out of range. Now, if it's way out of range, perhaps at a critical level where we really need to do something expeditiously, then I will get an alert. When I get that alert, I look at that blood pressure and I make a decision as to what needs to be done to help you manage it. If I look at it and I decide, say, that you need to take an extra blood pressure tablet, then I would call you and I would notify you to do that. On the other hand, if I look at the blood pressure and it's something that we call maybe a hypertensive emergency, where something needs to be done more expeditiously, I might contact you and instruct you to go to an emergency room or an urgent care to have that problem dealt with right away. In the event of something called a hypertensive urgency, say for example something happened and your blood pressure was really super high, I would get alerted that that blood pressure was at an unacceptable level. Now, here's the big thing though. In between the time that that blood pressure registered and the time that I contacted you, something transpired. Maybe you had a stroke, or maybe you just passed out because of your elevated blood pressure. When I tried to contact you, if I'm not able to reach you, then I would automatically reach out to the emergency contact person that you have listed in the information that you provide us. In the event that I can't reach that emergency contact person, or if the emergency contact person, for example, can't get to you for some reason to check on you, then I would automatically contact emergency medical services so somebody could come out and check on you and make sure that you were all right. One of the devices that is not available immediately but that will be coming soon is an emergency watch. And that watch allows you to actually make contact with us. Say, for example, we'll give that same blood pressure example. If the blood pressure was elevated and you've now fallen on the ground because you're having a stroke, we would try to reach out to you by buzzing that watch. And on the face of the watch is, it will say, are you okay? Yes or no. And you have the option of just clicking on the yes button if everything's all right, and then it goes no further. We don't have to necessarily reach out any further than that, sending someone out to check on you. However, if you were to click the no, we would know again that we need to immediately send someone out for your assistance. So this gives you another level of protection. If you're a Medicare patient, you're old enough that I'm sure you remember the commercial that used to happen, I've fallen, I can't get up. And they would push the little button and it would alert a monitoring service, and the monitoring service would send somebody out to help. This is basically the same principle, except for you just wear an attractive looking watch as opposed to the little gadget around your neck. As I said, there are several pieces of other equipment available to you, including a glucose monitor. And with the glucose monitor come all of the supplies. Here you have glucose test strips. You have the lancets. Everything that you need to help monitor your chronic conditions is available. Some of the other items available to you are a pulse oximeter. That's not immediately available, but it will be coming out very, very soon. So for people who have asthma or who have COPD, you can monitor the oxygen saturation in your bloodstream. That's also good in the event that, like recently here in California where I live, we had fires and the air quality was really, really bad. For someone who has asthma or emphysema, with bad air quality, there's reduced oxygen. And if you're already compromised, that oxygen level can get dangerously low. So that would be a reason to use the pulse ox monitor to find out exactly where that oxygen saturation in your bloodstream was and whether intervention was needed. Another good use for that pulse oximeter ties in to another device that will be coming out in just the next few months, and it won't be a moment too soon, because that is one of the touchless thermometers. While we're smack in the middle of COVID-19 and the numbers are increasing dramatically every day, it'll become important, if you're a Medicare patient, to be able to check the temperature of people that you come in contact with to make sure that they are not febrile if they're getting ready to enter into your environment. The other thing that's important is for you to be able to check your own temperature, though. I'll give an example. I recently had a patient who she wasn't feeling really, really well, but she wasn't really feeling bad either. She did have some upper respiratory types of symptoms, a little bit of a cough, and she just really, really felt weak. And as she started talking, alarm bells went off in my head. I'm like, we're in the middle of COVID-19. These are symptoms that could be consistent with COVID-19. So I asked her about fever and chills. Well, she initially denied having a fever, but then she said that she had been having chills. Fever and chills usually go hand in hand. So I asked the patient to take her temperature, and fortunately she did have a thermometer in the house. It wasn't one of the touchless thermometers, but it was a thermometer nevertheless. And even though the patient, her perception was that she did not have a fever, In fact, she had a fever that was over 101, and I immediately referred her to the emergency room for further evaluation, where she did end up being admitted. So you can see having this touchless thermometer at this particular time can be really critically important. So we're looking forward to that device coming out in the very, very near future. The other device that's coming out that will be really, really useful for patients who may not have access to a computer is the equivalent of basically a tablet. Now, this isn't a tablet where you'll be able to download and play games, or you'll be able to jump on the internet and do Facebook with your friends. You can't post Instagram pictures or anything like that. But what this particular tablet allows you to do is communicate with me through a telemedicine platform. The nice thing about this tablet is that the technology allows it to function off of the same platform that a cell phone does. So you don't necessarily need to have internet connection, Wi-Fi, a computer, any of that. As long as you can get a cell phone signal, you can use this tablet to do a telemedicine visit with me. You are allowed 60 minutes worth of communication with me in telemedicine visits a month. The important thing about that is that that will allow us to monitor and manage your condition. So if I'm monitoring your condition and the numbers are not quite what we want them to be, that allows you and I to communicate. So I can give you advice and recommendations on what you need to be doing in order to get that number, to get your result into an acceptable range. If your blood sugar is too high, I can check on you and find out if you're symptomatic and make recommendations accordingly. Or if it's too low, I would be alerted before you passed out on the floor. Or in the event that you didn't check the sugar until it was getting so low that you were about to pass out, even if you passed out, I could still be of assistance to you. Again, the pulse oximeter is a great tool for patients who have asthma or chronic obstructive pulmonary disease, also known as emphysema. In the event that the pulse ox is too low, then I could help make arrangements to get oxygen to you if you needed to have oxygen in home, or in the event that you did not have oxygen in home, but your numbers were low enough that you really needed it, I could advise you to go to the nearest emergency room, or in the event that it was critical, we could get emergency services out to you to get oxygen on board. And sometimes these things can be life-saving. So again, I'm very, very excited about this continuous monitoring program. Now, one of the questions that you may have is, okay, Dr. Cheryl, if I'm interested in becoming a part of this continuous monitoring program, does that interfere with the medical care that I already have set up? Would I have to give up my current doctor to become one of your patients? The answer to that is no, you do not. You can continue with your current primary care doctor or your current specialist without making any changes at all. I would just be a partner with them for your continuous patient monitoring. The results that I get from your continuous patient monitoring, I can share with them so that they can better manage your medical conditions. and be better healthcare partners to you along with me. Now, in the event that you do not have a primary care provider, I am a primary care provider. I practice integrative family medicine. So if you were interested in joining the program, but you do not have a primary care provider, then of course I could provide those services for you. But this particular program is a continuous monitoring program. So it is not your primary care program. It does not replace your primary care in any way, shape, or form. It is an ancillary service, an added benefit. And the nice thing about it, again, is this program is at no cost to you ever. The visits with me are at no cost to you. They're strictly billed through Medicare, and there's nothing that you have to do with that. All of the Medicare billing and the arrangements are handled through the company 100 Plus. The devices are all complimentary to you. Actually, they're not complimentary. They are at no cost to you. They are charged to Medicare, and Medicare pays the total cost. The supplies for your devices also are fully covered by Medicare, and there will never be a bill to you for any of these services. Getting set up with the program is really, really simple. You would contact me, and I'm going to give you my email address here, and you can contact me at my email address. Give me your name, your date of birth, and your Medicare identification information, along with a good contact number where I can reach you, and we will get in contact with you to help you get enrolled. The enrollment is simple. An enrollment agent will contact you and we'll ask you some basic questions to get you started into the program and to make sure that we're able to do the billing, to get your address so that we can get your devices right out to you. About the devices, there are, I believe, 5 different devices that are available to you. The devices are available to you based on the diagnosis that you have. Many people with even just one diagnosis may still receive more than one device. For example, a patient whose only diagnosis is high blood pressure still might receive a couple of different devices. One of those devices might be a scale, because patients with high blood pressure can get swelling of their legs and fluid collection. And we like to know if the patient is gaining and losing weight, particularly if we're putting you on a medication like Lasix. We like to monitor that, and we can monitor it through your weight gain and loss. The other device a person with high blood pressure obviously would be the blood pressure cuff. So that's an important item to have. Now, it is possible, however, that someone with high blood pressure might also end up with a pulse oximeter. It just really depends on what the condition is. If one has high blood pressure, and perhaps maybe one has a second diagnosis, like congestive heart failure, high blood pressure and congestive heart failure often go hand in hand, then that is a case where definitely we would want the patient to have a pulse oximeter, the blood pressure cuff, and again, we'd want the scale, because with congestive heart failure, again, we see that weight gain as they accumulate fluid. So you might have several different devices. Diabetes is another one where you often are going to have several different devices. You would have your glucose monitor, but it would also be important to keep track of your blood pressure and your weight. So again, you would have multiple devices. Obesity is one of those diagnoses that a lot of people are going to fall into that category. Unfortunately, obesity is at an epidemic level worldwide, especially in the United States. So, a number of people in the Medicare population would qualify for the continuous monitoring program with that diagnosis alone. And with a diagnosis of obesity, again, several of these devices might be in order. Definitely, we would want to get you a scale so that we could keep track of your weight gain and loss. We'd also want to have a blood pressure cuff. People with obesity frequently have hypertension as a result of the obesity diagnosis. We definitely want to get you a glucose monitor because people with obesity often have diabetes. As we gain weight, we also tend to become more insulin resistant, and that kicks us into what's called type 2 diabetes or adult onset diabetes. Having a glucose monitor will help us to keep a good track of that. Oxygen saturation, the pulse ox. For someone with obesity, this could be a very important item. One of the reasons is because people who are obese oftentimes will have sleep apnea as a secondary diagnosis as the the weight gains around the neck. It causes a compromise of the air passages, particularly when we sleep. And so one may notice that as we gain weight, we start to snore. This also tends to happen in the older population. So after about the age of 40, most people will start to snore. And the reason for this is just like externally, people start to notice wrinkling of the skin, loss of elasticity in the skin. This happens internally, structurally too. And when it happens internally, we may notice in things like our abdomen starts sagging. Other things start to sag too, like the structures of the jaw and the neckline, and the structures in the oronasopharyngeal area. That means the structures of the mouth and the nose and the area back in the back of the throat. Those tissues start to lose elasticity too and can become kind of floppy, so to speak. And when they become floppy, we lay flat, the airway collapses down on itself. And what makes the actual snoring sound is the force of the body trying to force air through those closed passages because the body knows that it has to have oxygen. So when the passages shut down, it puts forth a Herculean effort to blow them back open, and that is the snore. So as we age, we start to see more of the snoring as the structures become more lax. And when we couple that with obesity, where not only do we have lax structures, but we have the extra weight that's coming from our weight gain, that's not a good combination, and it does produce obstruction of the airway. When that happens, it's good to have a pulse oximeter to be able to monitor how much air we actually are getting into the bloodstream. And if we aren't getting enough air, usually we like to see it above 90% and really around the area of 94 to 100% oxygenation. In the event that that drops lower than 90, then we become concerned and we may want to do something about it. Certainly, if it drops down into the low 80s, it's going to be something that we may need to address. Now, there are people who have COPD who may have numbers in the 80s already. So if you're listening to this and you're one of those people who is saying, well, my pulse oximetry is always in the 80s, that's a good thing to know, and it's a good thing to monitor, because if we get into respiratory events, if you're already compromised that way, it becomes even more important to be able to monitor that. And again, right now, while COVID-19 is active in our communities, and while we're seeing an uptick in the cases of COVID-19, that becomes more and more important. So if you're already compromised in your respiratory status and you get what you may perceive as just a little cough or a little bit of a cold, it becomes really, really important for you to check your oxygenation status with the pulse oximeter and make sure that it hasn't dropped significantly to a level that might not be safe for you. If your levels are too low, you're not oxygenating your lungs, you're not oxygenating your brain, you're not oxygenating your heart or any of your other tissues as well as you need to maintain good health. So we definitely need to stay on top of these things. And wouldn't it be nice to have a partner with you managing your health, so that when you have those questions, when you check on things and you see that something doesn't look quite right, you have someone that you can reach out to and find out what those numbers mean. And isn't it comforting to know that as you're checking and we're monitoring on a regular basis, when something does go out of whack, you don't necessarily have to know what that means, or you don't even necessarily have to be able to identify it. You're not a doctor. I am. That's my job to know and understand what all of those numbers mean. And as your partner in health care, I can help you to understand them as well. Even if it's something that you don't understand, though, when those numbers go awry, I'm there to get your back, to make sure that we bring you back up to your optimal health status. An ounce of prevention is worth a pound of cure. And when we're monitoring chronic disorders, we want to optimize them so that even if they are chronic disorders that we're not going to have a cure for, at least we can maintain them at a level to have the lowest impact on your life so that you can live your best life on a regular basis. If you're interested in participating in this continuous health monitoring program, at the bottom of the screen here is my email, Dr. Cheryl at CherylBryantBruceMD.com. I'm partnered with 100 Plus to bring this awesome program to you, and I'd like to share with you as your health partner. So please, if you're interested in joining this program, or even if you just want to get a little bit more information about it, then contact me at that email on the bottom, and I'll reach out to you, or one of my partners at 100 Plus will reach out to you, answer those questions, and get you enrolled in the program. I look forward to being your partner in health. Again, I'm Dr. Cheryl, MD.